all waited for, right? Gonna do some hormones. Let's do menopause and perimenopause. Oh, are we ready? I'm sorry. Menopause. And this would be true also for perimenopause, would be the same. And a lot of the same herbs we're going to use for after menopause too. Not a lot of huge difference. Okay. So we're going to do action category based tour of how are we going to address menopause. The only question we need to ask is if people are doing hormone therapy already, like bioidentical estrogen or progesterone or testosterone, the question is, what are we going to do if they're on that already? And they're still not, kind of like we talked about with the thyroid, where you can be on thyroid meds and your labs look perfect, but you're still having every low thyroid symptom. So a lot of women who are taking estrogen and testosterone and progesterone are still often having a lot of symptoms, usually not the hot flashes part of it, but maybe having a lot of other symptoms like fatigue and brain fog and hair loss and depression and all kinds of other symptoms that can happen. So the hormones seem to be really good for managing the sweating part, but not always the best at some of the other problems. My personal preference is to have people try natural herbal medicine approach to menopause first before, to me, like even bioidentical hormone would be more of like a second level choice if the completely natural approach didn't work. I mean, in my experience, I've only seen, probably 5% of women that maybe had to have hormones or bioidentical hormones that the herbal medicines weren't strong enough. What is going to make menopause more challenging as far as like symptoms, or what's going to make it more challenging as far as like not responding as well to treatments maybe? What are the big questions we ask patients or symptoms we look for? We had talked about the Matthew Wood idea about suppressing all these fevers throughout their life with heavy Tylenol use and Advil use to suppress like fevers and pain and that. That's one question we kind of want to know about. We definitely want to know if someone's had anything removed, right? If you've had ovary removed, both ovaries removed, uterus, the more that's removed, right, the more challenge there is. So if a woman's had like a complete hysterectomy, it's harder, or it takes a little longer for natural medicines to work. They'll still usually work, but it just takes a little longer. So we want to know about if someone's had a hysterectomy. Right. If someone has at least one ovary, usually doesn't make a dramatic difference. But when they've had like both ovaries removed, it gets a little trickier. We also want to know what's the thyroid status, right? How's the thyroid doing? Are you on thyroid hormones? Are your thyroid labs good? Are you the person we talked about last week where you're on thyroid medications, but you're still having every low thyroid symptom? That's going to make it more challenging, right? We also want to know about someone's energy, because that's going to tell us about their adrenals. Remember, the main thing we need to remember is that as women move through menopause, the ovaries shut down production of hormones and the adrenals take over. That's like a key fact. Your adrenals start making more DHEA. That DHEA is then converted into whatever your body needs, but the ovaries start to slow down. This is why women who have adrenal fatigue and chronic fatigue have a much worse time with menopause, because they don't have that adrenal capacity to make DHEA and all the mother hormones. By mother hormones, I mean, like, everybody knows DHEA is what your body uses to make everything, just everything. So it's sometimes called the mother hormone. Okay. What else might affect menopause and how people respond? Use of, smoking cigarettes, use or abuse of alcohol is going to make it more difficult because the liver is going to be more affected.
Like the history of drinking alcohol?
Both. So strong history of those things or current smoker drinkers. So alcohol, smoke. We also want to know, what is a woman's history of birth control? Is this someone that's used birth control most of their life? That means it's probably going to be a little bit slower, right? Remember, none of these things mean that herbal medicines won't work. It just means it's probably just going to be a little slower progress. What I have found when most women are coming with menopause, the symptom that is driving them to uncomfortableness is the hot flashes and sweating. So, like, to me, what you want to listen to what people are asked for. Like, women, can have fatigue and hair loss and, vaginal dryness and low libido and, mood changes or depression or anxiety. But when they're talking about severe hot flashes and sweating, this is like a quality of life issue that they just really want fixed right away. And if you can't deliver, they tend to not be very patient about it, especially if they're not used to natural medicine. So it's important to know these protocols too, because a lot of women, because of their genetic history, and the more we know now about genetics and screening, like, a lot of women have estrogen positive genetics, like, just should never do estrogen. So we also see a lot of women that just can't do it, or their doctor won't allow it. So we have no other option but something natural. Okay. And I know there's some functional medicine doctors that say, well, there's no research that estrogen or bioidentical estrogen causes estrogen positive cancers. But I know so many women that were on mega doses of estrogen that had really advanced, fast moving breast cancer and other cancers, likely from that were really upset that they did it. They were talked into it by their kind of like functional doctors about it. So it's just not worth the risk, to me personally. So so the debate will go on to me, but to me, just that's just not worth the risk when there's so many other options. There's no other options that'd be different. So, by the way, this is the same protocols or similar that we're going to do when women who have breast cancer are taking estrogen blockers and they're wanting help because they're having severe hot flashes and muscle aches and joint aches and depression and fatigue. So the same type of protocols, some of these herbs are going to be the key ones we use in that situation too. Okay. We know historically that, menopause is, although a natural process, the intensity of symptoms have really arrived with processed food and processed diet and the industrial lifestyle. So we know really well from historical records and ancient writings that, women definitely had some symptoms, but nothing to like the severity and degree that we have today in America, at least. So same with women, younger girls starting their menstrual cycle. It's, historically, that wasn't such a dramatic set of symptoms as it can be today with younger girls. So, yeah. So in fact, like in Chinese medicine, there's not a lot of menopausal mention until modern times, which has a really long record documentation.
We should note down to South America. That's what I remember reading. The girls were starting to get their periods.
Yeah, yeah. So yeah, the other thing we need to just remember too is there's just so many xenoestrogens, right? Plastic estrogens and things in our world. The problem with xenoestrogens is they do have estrogen activity. So they do bind with estrogen receptors, but they actually have activity. So these would be all the estrogens that are in plastics. And, unfortunately, it's like really depressing, but it's everywhere, right? Every type of plastics manufacturing, all types of laundry detergents, and all this, anything that touches plastic container. Even if you're eating organic and your organic vegetables get shipped in like plastic pack, like it's hard to really, we can't really get away from plastic in our world. And it's kind of sad. I mean, we can, but it's pretty big effort. Any plastic bottle we're drinking out of, or microwave container, or anything. So it's, we just try to educate people to minimize exposure to plastics, right? So it's kind of depressing though, especially for younger kids, our children and the next generation, Victoria's children. She's older, right? Gonna have to think about all this. So it's pretty sad because it's pretty bad, right? The average American has a credit card of plastic in your body. And plastics can't be detoxified. There's no way for the body to detoxify plastic, so it just gets lodged in the tissue, like organ tissue, liver, kidneys. So like all the biopsies of humans now, most of them have microplastics in their liver and kidney and muscle tissue and brain tissue. It's like really sad. So I don't know what nature's doing about that. I'm sure there's a solution. Sure, there's an herb or something we're going to figure out. There's always a solution, right? But I don't know. Probably it's got to be something like that. Yeah, there's a solution out there. We just haven't like really found it yet. Okay. Stress is also going to really increase menopausal symptoms. What else is going to increase menopausal symptoms? Coffee, caffeine, alcohol, right? The big three, right? Coffee, caffeine, alcohol. Women that have going through menopause will just tell you, yeah, that flares it up. Especially red wine, right? Red wine, especially bad for triggering hot flashes with women. Okay. Okay, questions yet? We good? So, getting back to the xenoestrogens, this is why women and modern times are just going to be entering menopause earlier and with more severity of symptoms because of all these estrogen compounds from the plastics and that, right? So that's kind of depressing to think about, really. It's depressing to me, and I have young girls especially. I think about it a lot. Really sad. Questions on menopause, or questions that you have, experiences that you want to share?
Vinyl, I think it's vinyl. What are those? When you have glass Tupperwares, some of them are plastic and some are
Silicone. Silicone allegedly is safe, as far as we know. At least it doesn't have microplastics in it, but I don't know. Yeah, better option. Yeah. Glass bottles. I mean, we're trying to drink from glass bottles and all that too. That helps. Yeah. Yeah. For cereal, even healthy, right? Rice comes in packet, everything's got this touches plastic. So it's kind of concerning. That's really challenging to get away from. Okay. So what we're going to do to help people is this. We're going to start with, usually we'll do, depending on the female and their health status, we usually do at least one hepatic in their protocol. These are our liver herbs, right? Why are we going to do hepatics? Because why? For menopause? Because the healthier, remember, our liver is monitoring all the hormones in the bloodstream, telling the body to make more or digest, break down hormones quicker or make more. It's kind of the computer system of the body. So the healthier our liver is, the more tight control of hormones the body can have. Hepatics are also how we can detoxify xenoestrogens out of the body with hepatic herbs too. So that's exciting. We can also detoxify these plastic estrogens out of our body through cruciferous vegetables, like broccoli, cauliflower, Brussels sprouts, right? These things are really helpful for getting these these plastic estrogens out of the body. Okay. Okay. So we're going to use hepatics for people that obviously have like liver digestive problems. They're going to be having a lot of probably gas, acid reflux, indigestion, probably going to have a hard time breaking down proteins and fats, bowel issues like constipation or loose stools. Also, when women are on estrogen and estrogen bioidentical hormones, we always give them hepatics when they're on hormones. Because what the hepatics are going to do is they're going to help stop estrogen medications from being converted into bad estrogens that can trigger cancer cell lines. So if women are on bioidentical hormones, we're going to always do hepatics to help protect them and just make sure their liver is functioning well. So there's a couple special hepatics, but the 2 or 3 hepatics that work the best are blessed thistle, herb, Oregon grape root, and dandelion root. These are ranked, in my opinion, number 1, number 2, number 3. Blessed thistle is really the most specific hepatic and digestive bitter also, right? These are all bitters. Digestive bitter for women going through menopause. These are the same herbs we're going to do for younger women when they're having really bad menstrual cramps or pains and they have a lot of liver digestive issues. So blessed thistle is just one of those amazing women's herbs. It can help. This is the Dr. Christopher had this famous formula called Change of Life for menopause. And blessed thistle was one of the, to me, one of the key ingredients in the formula. Yeah, I can't tell you how many women throughout the last 30 years or so that got benefit from the Change of Life formula. So, but blessed thistle would be one of the key herbs, more of like a cleansing formula, actually. Okay, so this is going to be for women who have a lot of estrogen. I mean, like plastic estrogens, they're having a lot of digestive problems, skin problems, liver problems, acne, things of that nature, other skin rashes and inflammation. We're going to use hepatics, especially blessed thistle. Remember, blessed thistle was one of our special herbs for fat malabsorption. Okay. Usually, just to review, the tongue, the sides of the tongue was someone that really needs this for menopause. This is going to be redder, right? Or we could have dots on the sides, red dots. These are the liver zones of the tongue. So the right end or the left side will be having reddish color or reddish dots. Okay. There's a lot of other hepatics, right? They would all be good. These are really, in my mind, like the best 3. Okay. Okay. All right, ready for the next one? Adaptogens. So who that is experiencing menopause, what symptoms are we looking for with adaptogens? Like fatigue, extreme fatigue, brain fog, chronic fatigue, a lot of fibromyalgia type symptoms. Women who have, remember, low thyroid, being treated for thyroid and not getting results. Both of these groups, guess what? We can do safely with estrogen or other bioidenticals. So we can use adaptogens and hepatics no matter what people are on. This is also if women say, hey, I have, like a cancer, I have to get off of estrogen right away. These 2 groups are how we help people get off of estrogen really fast and onto something natural. Because as they're still taking the hormones, we have them do these 2. Then as they wean off, we wean them on to some other things we'll talk about. Okay. What are some of the best adaptogens that are really specific for menopause? Some of these are really highly researched. Probably the most researched one of all is going to be red Chinese ginseng. This we're going to do. Someone has pretty extreme fatigue and chronic fatigue, low blood counts, super weak. And believe it or not, it's really, 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 really good for hot flashes, even though it's a pretty warm herb, right? Very energizing. This, we have to remember, red Chinese ginseng is one of the main two postmenopausal herbs. So after women have moved into postmenopausal state, we're going to do red Chinese ginseng. It is the #1 triple star it for vaginal dryness from postmenopause. For women that have pelvic floor pains from vaginal dryness, that are getting pelvic floor therapy, it doesn't help the pain, but it actually treats the dryness. I remember I worked in the health food store. This one lady who was just like a chronic oversharer. You just had to like know her personality. She was older, and I don't think she had ever was married or ever had a partner. I don't know, but she came in one day just proudly proclaiming to the entire store that I helped her with her vaginal dryness, and she was so happy. I just never forget. Like the whole store was like, "Whoa, overshare!" So, there are probably like 30 people in the store. She's just like loudly proclaiming this. She didn't even like look at me. She just came in and like started talking to me. I was talking to somebody else. I was like, "Oh, good, good, good." It's like, I tried everything. This guy helped me, this ginseng stuff. She had tried like estrogen suppositories and everything else, and it was just the ginseng that did it. So the more fatigued somebody is, the more we're going to do Chinese ginseng. So that's one of the best adaptogens to know. So remember, ginseng is also good for weak digestion, just weak anything, weak immune function, shock, fatigue, everything. The other one that's really important as adaptogen, we haven't talked about a lot, is maca root from Peruvian mountains, right? So maca root is one of our main, we talked about it more as a mild adaptogen, and it's really good for anemia and as a blood tonic. But this herb is really, really, really good for menopause. And you can do it if you're on estrogen and bioidenticals. So for women that are on bioidenticals and still have extreme fatigue, this works really, really well. It's also really, really, really safe. Mostly used as a capsule or powder, but the tincture will work. But realize like this is really popular as like a health drink with women. So some women are drinking like 5,000 milligrams of, like a whole tablespoon of it, which is a lot. So, I mean, you can get a pretty big dose of it and it's still very safe. So maca root. What's maca renowned for with menopause? It's for women and men, it's a super libido tonic. It's also a fertility tonic. We'll talk about it a lot in fertility and infertility. Okay. Next one, Schizandra berry. So Schizandra berry is a really gentle adaptogen. Remember, it's not like super energizing, but guess what? This little herb is really, really, really good for hot flashes and night sweats. So it's an adaptogen, but remember we said Schizandra was kind of like ashwagandha in that it's a little bit energizing, but it also calms and focuses your mind. Schizandra, we had said, is also very good for hormonal brain fog. So it's used a lot in Chinese formulas with menopause. I really, really like it a lot. It's a great adrenal herb, super safe. So this would be better for someone that doesn't want like the extreme energizing of like Chinese ginseng. Okay. The other one we're going to do is a licorice root, which is, even though it's slightly warm, it's rich with all of these kind of hormone-like compounds. And it's a major adrenal restorative, and it's really, really good for people who have excessive cortisol from chronic stress. Also good for vaginal dryness. And remember, licorice stimulates the ovaries. So even if there's one ovary, it's still really helpful to improve the overall functioning of the ovary. We use it a lot also, we talked about, for poor digestion and inflammation in the body, right? We said it's like a natural steroid. So it's really good for women who are menopausal and have a ton of autoimmune diseases and have a ton of like arthritic and fibromyalgia type aches or pains. So I use it a lot for like women that have rheumatoid arthritis and fibromyalgia that have menopause. It's really helpful for. Because a lot of times fibromyalgia will get triggered in menopause. Okay, let's do one more in this category. Another herb that's helpful here a little bit is ashwagandha. This is going to be, again, more for people who are tired and wired, right? Where you're super fatigued, but you're also super anxious, having the insomnia parts of menopause. It doesn't help hot flashes that much, but it's really good for the fatigue and insomnia. And it's especially good for women that are having low thyroid function. Okay. There's other ones too, but let's do one more. Darn it. Let's do one more. I feel like we haven't talked about this herb much. So the other herb that's really helpful to know is Rhamania root. Remember, in Chinese, this is a yin tonic, so we use this for dryness. So this is extremely helpful for also vaginal dryness. It's really close second behind Chinese ginseng. It is really good for women that have adrenal fatigue. It's really good for anemia. It is just a major herb. It's also good for people that have been taking steroids or cortisol type compounds. It can help restore the adrenal function. But it's in Chinese medicine, this herb is very cooling for regulating hot flashes. And it's very good for postmenopause. This is really, in my mind, the most important herb for women who are on estrogen blocking drugs because of cancer and are having menopausal symptoms. Rhamania is one of the main herbs that we do. Yin tonic is one of those moisture tonics. You
say good for estrogen blocking.
It is good when women are taking an estrogen blocking drug because they have like an estrogen cancer, like breast cancer or uterine, ovarian cancer. Okay. So both of these, just to review, are good for total hysterectomy. Women who are taking hormones or not, we can use them in any situation. That's how we're kind of starting this, okay? one more category that is in like the all purpose here. Okay. Next one is nervines. When are we going to use nervines during menopause? Could be nerve pain, neuropathy pain, muscle tension, fibromyalgia, but especially anxiety and heart palpitations. Any nervine will help here, by the way. I've learned over the years. But there's a couple of nervines that we specifically use for menopause I want to call out. The first one being blue vervain, which is one of the most important menopause herbs we need to know. Okay. Blue vervain herb. Remember, it's bitter and it's really cold. Okay. Super bitter and super cold. Okay. Blue vervain, we said, was really good for wood types, type A personality. These, maybe we could say people who are having anxiety that looks like frustration, anger, resentment, right? A lot of women with menopause will come in and say, you know, I'm not having a lot of other symptoms other than I just feel like really irritable. So not necessarily even anxious, but just kind of like irritable or angry or a little frustrated. This, we said blue vervain is also really specific for that neck tension. So why this herb is really important is it cools the body through the hypothalamus and pituitary. So this group we can also use whether you are on hormones or not, whether you've had a hysterectomy or not. All three of these first categories can be used. If you're on an estrogen blocker or not, the first three categories can be used, okay? But blue vervain is one of the best herbs to get body temperature down when women are having more severe hot flashes. It's very bitter. It does not, it's hard to get this down as a tea. Remember years ago when I was really young, I had a client who, yeah, she had menopausal hot flashes and anxiety. And she didn't want to do hormones because of her family history. And for some reason, I gave her blue vervain tea. I think she wanted a tea. I'm like, it's really bitter. She's like, she came back like a couple weeks later. She's like, the blue vervain works like 100%, no more hot flashes. But she says, like, I puke if I drink more than a cup. So I'm like, okay. So I'm like, we can do this as a capsule or like a tincture if you'd rather. She's like, no, I like the tea. I like the bitter. I'm like, okay. So there's about 1 cup a day, just kind of regulated her hot flashes and she's very like irritable. Tincture works good. Yeah, you can't really buy it as a capsule. So we're kind of limited to tinctures and the teas that just doesn't taste very good.
So 30 to 60 drops.
Usual dose, yeah, 30 to 60 drops 3 times a day. I usually will put it in a formula with other stuff. It works really well with these other herbs we're talking about. But you could do it by itself too. Yeah, really, really good with for neck tension. Targets that part of the body. Okay. Of all the other nervines, the other one that works good is the cactus stem, what we call the night blooming cereus. Okay. When, other than being like a really great nervine, when are we going to use night blooming Shreya's cactus leaf or stem? Especially when women are having all kinds of chest and heart palpitations, where their anxiety is creating heart palpitations. They're feeling pressure in their chest and heart. And also we use this herb for menopausal depression. It's probably the best herb for menopausal depression. Works really, really, really well. Remember, this is like a moderate dose herb. It doesn't take a lot. We really can only get it in a tincture format. So usually just like 3 to 6 drops of the tincture 3 times a day is enough. Usually what I'll do is I'll put about 5% of it into a tincture, and that's usually enough. Doesn't take much. So just like 5% in a tincture, it's usually enough. Okay. Couple more. This is one of my all-time favorites. I always forget how good it is for depression because I always give it for heart palpitations with menopause. And I'm always reminded when women come back in like 5 or 6 weeks just talking about how much their mood has changed from it. Okay. The other one that's really helpful, which one are we going to do? We got to do this. We haven't talked about this herb a lot, so let's add it. Pulsatilla flower. This is a lower dose herb. Again, we can only really use this as a tincture because it has to be fresh. You can't buy it as a capsule or even a tea. So it's like an artisanal herb. This herb is specific for menopause with anxiety and actual panic attacks with menopause. And it's very good for anxiety and night sweats. And in my opinion, like the weirder and more wild a woman's hair is, like the more for oddly this herb likes to work. Like a women that have really wild hair that's kind of going everywhere and looking kind of cool. It's really, 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 really helpful for. So this is one of our main panic attack herbs. This is our herb we use for what's called PMSA, premenstrual syndrome with anxiety, but it's a lower dose herb. So again, we only put about 5% in a formula. Or this one we just do about 3 drops 3 times a day. It does not take much of this plant. And we want to dilute this because it's a little caustic. You know, some of those herbs we've taken that kind of hit the back of your throat like a little acrid and caustic. This is one of them. Textbook, you know, a lot of old or like a lot of medical textbooks will say it's an unsafe herb. It's very safe as long as you're just doing a regular dose of it. Okay, called Pulsatilla flower. This is the prairie flower called past flower or wind flower. This is the first flower that comes up on the prairie in Nebraska. In fact, in a lot of local Native American lore, a lot of natives had a belief something to the effect of like this flower. It's a very long story that I won't do justice. But this flower comes up first and then the earth awakens. It's like the awakening of the earth flower. It tells all the other flowers to wake up, but it does actually come up through the snow. Yeah. It's not super common. It's not very big. So when you pay a hefty fee for it, it's definitely worth it. Okay. So all the other nervines will be helpful. These three really, really stand out. If you know somebody that just has anxiety attacks and panic attacks, this pulsatilla is really, really good. Even outside of menopause, yeah. Men and women both, but it's one of the main eclectic herbs for anxiety. Let's do one more. I mean, another one that we use a lot for menopause is motherwort. Motherwort herb, remember, which is very cooling. What are we going to use mother's wort for besides, anxiety and cooling the body? Remember, it really targets the heart also. So this is a major herb for menopausal heart palpitations, chest pressure, chest pain. What's the challenge with using a lot of it? What does it suppress if we do too much? It can make your thyroid a little less active if we do like too much of it. So if someone has low thyroid function, we usually won't use this herb, or we will just use a smaller amount in a formula. But again, this can be used anytime someone feels hot, agitated, panic attacks, heart palpitations, but it's especially good for menopause. Really does have some hormone balancing property. Everything we've talked about thus far has no hormonal property or hormone binding property. These are just all we call off or on the table for anything, no matter what presents. Use blue vervain a lot when women are on the estrogen blocker to help cool them off really quick. Okay, we're still, so 3 categories, everything's still on the table, right? Zero controversy so far, right? We haven't got, next week is the controversy we have to unravel, right? With phytoestrogens and all of this. We haven't got there yet, okay? So the next one is the other category that we can use no matter what, that is antidepressants. There are a lot of in fact, antidepressants are now approved as a medication for menopause, right? Because they do have some effects on neurotransmitters that can affect symptoms of menopause. So what are our main, so these are the herbs we're going to do when someone has more anxiety and depression that predominates during menopause, or someone says, hey, I have a really long history of depression. I'm going into menopause. I'm really afraid this is going to trigger me. Or a lot of women who, were on estrogen or birth control their whole life, who have to get off of it, who used it to manage their depression, and now they can't do it. So what are the two? There's 2 antidepressants that work really good for menopause and can also cool the body off and help hot flashes, but also help anxiety and depression. I mean, holy basil would be good just for the depression, brain fog part, but there's 2 that are even better. So the lemon balm can be very helpful too. Linden can be helpful. St. Johns Wort, really, really helpful for menopause, menopausal hot flashes. So St. John's Wort flower, right? Fresh if possible, right? So capsules or tea or tincture, prefer the fresh plant tincture. This is really good in formulas. It's really good as a standalone. This can be used if people are on estrogen blockers, they're on estrogen hormones or birth control, we can kind of use it. Oh, no, we cannot use St. John's wort with birth control, but we can use it with estrogen for menopause, like bioidenticals. Okay. So it's really good for people that have more severe depression or seasonal affective disorder and anxiety with their menopause. Okay. The other one, surprisingly, that's really good here, and there's a fair amount of research also used more in Europe this way, is lavender flower. Remember we talked about as a really mood uplifting herb. Very similar to holy basil, except for the fact that it actually has been shown to reduce menopausal hot flashes and menopausal anxiety. So just like more, I think, researched here in modern times. It's also good for insomnia with menopause. So anytime we have depression, especially some anxiety, insomnia, we could use St. John's wort or lavender. Why would we maybe choose lavender over St. John's wort, or vice versa, for someone that has menopause? What other maybe conditions might we favor one or the other? So lavender is really soothing to gas, bloating, cramping, because it's a carminative. Lavender, even the smell could possibly help people. Yeah, yep. Lavender is very like uplifting. It's so aromatic, right? St. John's wort's probably better for people that have clinical depression, like long-term clinical mild depression, where lavender is very mood uplifting, but for the right person, it could work. But as a general rule, St. John's wort is just so powerful for depression. What's that? Rose would be another one that we could use here too. It's helpful.
So they're menopausal and they're
right. Yeah, one good benefit is lavender doesn't interact with any known medication. We can use it with like anything. Where St. John's wort is just so reactive because of some of the things, good things it does to the liver. So yeah, lavender is kind of like one of those we never have to worry about herbs. Lavender would probably be better for people who, because remember, it's uplifting and very aromatic, for people who have like, especially like a lot of brain fog. For St. John's wort is for someone that just like, you know, they've been depressed like their whole life, or yeah. Yeah, Dongguai is primary, but it's coming up next week. Yeah, that's one of our main herbs. So we're doing like, yeah, right now we're going around the edge of like the key herbs, and then we're moving into the center. So again, these herbs can be used with whether people have had a hysterectomy or not, whether they're on bioidentical hormones, whether they're on estrogen blockers for cancer. We can use these kind of across the board. Okay. There's other mood uplifting herbs that would be good, but these are all specifically researched with menopause too, though. That's why I kind of like narrowed it down. Okay. Let's stop there, because from here it gets tricky. We have to be really methodical next week, because we're going to really truly understand this ridiculous term called phytoestrogens, understand the controversy and the science and all of that. So you all can educate the world about it, because you'll get asked it all the time. So, and we'll do the like uterine, ovarian herbs and all that. So we're kind of like, the ones we did so far are all the peripheral things that aren't like directly touching hormones, so we can use them for about any situation. A lot of patients come in and say, I don't want, I want help, but I don't want something that's going to be hormonal because I have like estrogen cancer in my family. And so some people, this is like all we might use are these things on the periphery.
Just wants to confirm, or can be used topically, like on the fever.
Lavender, I don't know if it's been studied diffused aromatherapy for menopause, but yeah, it would be safe to use topical too. All right, so that's where we're going to leave off. And now next week, we're going in for it. It's going to be a very complicated discussion on how phytoestrogens work and all the misinformation out there.